Assalamu alaikum. Welcome again at National Institute of Physical Therapy and Rehabilitation Science. My name is Sadaf Subhi and I am a physical therapist and senior lecturer at NIPERS. Thank you for joining us. In previous video, we have discussed spondylolisthesis. Now in today's video, first we will going to talk about degenerative spondylolisthesis. Then we will cover the remaining aspects of spondylolisthesis. So here are the topics which we are going to cover in today's video. Before going to jump on what degenerative spondylolisthesis is, let's revise that what mechanism works in normal condition. Under normal condition, the anterior slippage of the vertebra is resisted by the bony block of the posterior facets by an intact neural arch and pedicle, and in the case of the L5 vertebra, by the iliolumbar ligament. Spondylolisthesis refers to an anterior slippage and inability to resist shear forces of a vertebral segment in relation to the vertebral segment immediately below it, and spondylolisthesis leads to spinal instability. Degenerative spondylolisthesis occurred 4 times more frequently in females at the interspace between L4 and N5 vertebrae. It's not the result of a pars defect but a complex interaction between the disc, facet joints and the ligament structure. In degenerative spondylolisthesis, the pars is intact and the vertebrae as a whole slips forward secondary to osteoarthritis of the facet joint and insufficient ligamentous support. It typically affects people who are 50 to 60 years of age or older. This type of slip occurs not because there are cracks in the pars, but rather it's due to changes that occurs in a spine that ages. Some folks, as a disc and spine age, the vertebra at the end of the spine slipped down the slope of spine. Most commonly occurs at L4, L5 level. This type is more common in women than men. As a disc wear down, the ligaments gets loosened and the vertebra starts to move. Degenerative type takes decades to develop. Most slips do not progress more than grade 1. However, the degeneration of spine will continue and this can lead to progressive narrowing, turn spinal stenosis. After a brief discussion about degenerative spondylolisthesis, let's talk about the symptoms. These are the commonly present symptoms on which one can diagnose spondylolisthesis. Patients with spondylolisthesis often present with low back pain localized to the paraspinal and gluteal region, restricted range of motion of the lumbar spine, decrease in the lumbar lordosis, excessive hamstring tightness. These are the differential diagnosis. Number 1 is lumbar facet arthropathy. It is a degenerative arthritis. Pain radiate to gluteal, back of the thigh with no muscle weakness. In coccydyna, pain and tenderness at coccyx, and the pain is worse in sitting. Then mechanical low back pain. It is a most commonest cause of lower back pain, primarily from the muscles which become strained, ligament joints, maybe facet joint, sacroiliac joint or bones in and around the spine. Pain tends to be localized to the lower back and buttocks. Then overuse injury resulting from repeated extension and rotation of the spine. Symptoms can include pain, muscle spasm and stiffness. The pain often goes away within 4 weeks without any treatment. Then lumbar compression fracture. It is characterized by intact middle and posterior columns with compression and loss of height of the anterior column. Lumbar compression fracture due to trauma or pathology. There is a sudden back pain radiate to lower limb. If the nerve roots also affected, then numbness and motor weakness in lower limb also occur. lumbar canal stenosis, weakness, numbness, pain and loss of sensation in the legs. Then we have disc herniation, low back pain, leg pain. Coughing and sneezing aggravates the leg pain, relieved by walking or lying down. Treatment. We will not going to discuss surgical treatment in this video. We will discuss physical therapy treatment in today's video. So starting the physical therapy treatment, following modalities can be used for pain management. TENS, blocking the same pain receptors that cause the nerves to irritate due to the spondylolisthesis. Ultrasound, for proper tissue healing, break down scar tissue, increase circulation to the area and relax the musculature. Ice pack, use ice gel pad initial to reduce inflammation and numb the pain. Hot packs, useful for increasing circulation and thereby loosening up the muscle tissue. Traction can be used in early stages to unload the spine and release the nerve pressure. If the multifidus muscle is in too much spasm, it will not allow the separation of the vertebra. In later stages, traction combined with body movement may also help to break up scar tissue built up between the joints. Now rehabilitation. This is the rehabilitation program which can be used for a grade 1 spondylolisthesis. It is divided into phase 1, phase 2 and phase 3. Other exercise regimes are discussed further. Let's talk about other regime of exercises. So strengthening exercise will improve the range of motion of the back, abdomens and legs, help relieve pain caused by spondylolisthesis. Stretching exercise should also be performed. It includes back flexion stretch, gluteus stretch, hamstring stretch can be done in various positions as taught by our physical therapist. It is very important stretch to prevent tightness of the muscle due to the pain. Following are the methods of stabilization exercise. Pelvic tilt is very important to prevent lumbar lordosis. William flexion exercise is very helpful to reduce a spasm and to maintain the flexibility of your back. It could be performed with single knee at a time or with both knees towards chest at a time. Exercise should focus on dynamic stabilization of trunk with particular emphasis on abdominals. Progression should be made to improve strength. The progression exercises: resisted isometric using cane, in supine position, abdominal crunches on the physio ball, abdominal stabilization during oblique lever changes, plank to activate transverse abdominal muscles. Why we are targeting transverse abdominals? Because it is an extremely important muscle that acts as a stabilizer for the entire low back and core muscles. It is a deep abdominal muscle that works like a belt around your waist to protect your spine. You can teach patient bird dog exercise with variations, could be plank, side plank and many others. Then we have non-local muscle strengthening. Non-local muscle fatigue is characterized by muscle performance impairments in a contralateral or remote non-exercised muscles following a fatiguing protocol of a different muscle group. Co-contraction of the spine during ADLs. Muscle co-contraction is the simultaneously activation of antagonistic and agonist muscle, plays an important role in stabilizing lumbar spine to minimize the effect loads at spine. So there is an active subsystem which includes global muscle, which are external oblique and rectus abdominis, which are the general trunk stabilizers. Then we have local muscles, lumbar and paraspinal muscles. These maintain mechanical stability and also control spine curvature. So all these will work together to maintain a pain-free back. A physical therapist must educate the patient about the following things. Corsets or braces are only for temporary relief. It is not the way out. Bracing does not seem to influence outcome. Then use the correct mattress. Correct shoes should be used and a heel lift so that of the back can be released. Ergonomical issues should always be addressed. Spinal extension exercises are contraindicated. Chair with a good cushion should be used. Adjust height of the chair. Tilting the front of the seat downward, lower back into extension. Increase the lower lumbar curve. Tilting the front of the seat upward. Decrease your lumbar curve. Combine the seat angle tilt with the seat back tilt for optimal support of the back. These are the points one should also take care of it. Maintain weight with very good posture using corset while traveling. Use correct foam mattress, walk daily, proper footwear, exercise and follow instructions regularly. I hope this information will work for you. Thank you again for your time.